Good day to all. In today's video, let's discuss about type 1 hypersensitivity. So, hypersensitivity is defined as an exaggerated immune response that causes damage to the individual. So, immune response is always to protect the host, but in hypersensitivity, the immune response becomes injurious to the host itself. So, as a result, the cell of the host or killed, or the host itself is damaged or killed by your immune response or immunological reaction. So hypersensitivity does not occur in all human beings. Only 10% of the human population suffers from hypersensitivity. So the factors causing hypersensitivity are called as allergens, and hypersensitivity is also generally called as allergy. So hypersensitivity can bring its symptoms either immediately within a minute or in a delayed state after 24 to 48 hours. So the allergens may be, the factors that causing hypersensitivity might be extrinsic factor or intrinsic factor. Extrinsic is nothing but when an antigen is introduced into the body from outside. So intrinsic is the factor which remain within a body and cause a hypersensitivity reaction. Classification based on different mechanism of pathogenesis. So here there are four types of classification. Type 1 is anaphylactic hypersensitivity, type 2 is antibody dependent cytotoxic hypersensitivity, type 3 is immune complex mediated hypersensitivity, type 4 cell mediated hypersensitivity. In this, except type 4, all other type 1, type 2 and type 3 are immediate hypersensitivity, whereas type 4 alone is a delayed hypersensitivity. In this classification, today let's discuss about type 1 anaphylactic hypersensitivity alone. Classification based on time taken. Immediate hypersensitivity. So when the immune reactions are manifested in a short duration of time within minutes, it is called as immediate hypersensitivity. For example, penicillin allergy. So here the inflammatory response occur within a few minutes, and immediate hypersensitivity is antibody mediated here. And in delayed hypersensitivity, when the immune reactions are manifested slowly after 24 to 48 hours. So the hypersensitivity is called as delayed hypersensitivity. So example is Mantox reaction. So here the inflammatory response occurs after 24 to 48 hours. So delayed hypersensitivity is a cell mediated immunity. So type 1 anaphylactic hypersensitivity is an immediate type 1 hypersensitivity reaction which is triggered by IgE mediated mast cell degranulation. So anaphylactic reactions are caused when the sensitized animals receive the allergens for the second time. So the factors causing anaphylactic may be animal danders like hair, scale and feathers, and also plant pollens such as ragweed, and foods such as eggs, fish, peanut and all, and also insect venoms, and drugs such as penicillin, sulfonamides and salicylate will be as a factor which cause anaphylactic hypersensitivity. So the mechanism of type 1 hypersensitivity can be explained in three phases. So one is sensitization phase, activation phase and effector phase. So the main reason for this type 1 hypersensitivity is IgE. So in sensitization phase, when a person receives the allergens of any of the factor, which means the antigen, for the first time, the allergens get attached to the B cells. So the allergen stimulates the B cell to produce plasma cells, which in turn obviously produce an antibody, a specific antibody, which is IgE. So the IgE antibodies are called as regions which are produced by the people who are allergic for this any of factors. So it is strong affinity for fixation to mast cell or basophil in skin or mucous surface. So IgE antibodies, with the help of Fc segment, it binds to the mast cell. So this reaction does not harm the person, and the person is now said to be immunized or sensitized for the particular antigen. So this is said to be a sensitizing or a primary dose. So subsequent contact with the antigen for the next time, or the antigen causes manifestation of hypersensitivity, which is known as shock dose or shock stage. Activation phase. So when the person is exposed to the same antigen for the second time, IgE antibodies attach to the surface of the mast cell and it binds with the antigen. So the antigen cross-link the antibodies, and during this cross-linking it stimulates the mast cell and a series of enzymatic reaction happen inside the mast cell. So the mast cell will release the granules, and the phenomenon of releasing granules from the mast cell, and it is called as degranulation, and the granule contains substance like histamine, serotonin and heparin. So manifestation of anaphylactic is mainly due to these mediators. Mediators in the sense whatever which is getting released during the degranulation. Effector phase. The mediators are of two types. One is primary mediators and secondary mediator. Primary mediators are histamine, serotonin, and heparin. They are released from the granules of mast cell and basophil. Secondary mediators, they are produced by leukocytes on stimulating of mast cells. So these mediators bring about the anaphylactic reactions such as burning, itching, and vasodilation, edema, and smooth muscle contractions, and etc. Localized anaphylaxis, it is also called as atopy. So atopy refer to naturally occurring hypersensitivity, for example asthma. The antigen responsible for atopy are called as atopins. In atopy, IgE antibodies are produced in larger amount, and symptoms may include dermatitis in skin or vomiting and diarrhea, and in the case of asthma, shortness of breathing will be there. And diagnosis, to detect the type 1 hypersensitivity, it can be detected by skin testing. So the small amount of allergens are introduced to the specific skin site. So if a person is allergic to the allergens, mast cell will degranulate and release the histamine and other mediator. So it will form a wheal and flare responsible within 30 minutes. So using that, we can detect the allergic or hypersensitivity reaction. And the advantage of this test is it is inexpensive, and along with that radioimmunoassay can also be done to quantitate IgE level specifically in the serum. And advantage of this RIA is it is highly sensitive, and prevention and the treatment of type 1 hypersensitivity is that anaphylactic can be prevented by avoiding contact with allergens, and hyposensitization where it involves injecting the patient with increased dose of responsible allergen. So this stimulates the production of IgG. So IgG antibody react with the allergens and it prevent the contact with the mast cell, so that the degranulation or the mast cell production or increased degranulation, and so that the mediators producing from the mast cell will be decreased, or it can be stopped or reduced. So drug treatment in the case of type 1 hypersensitivity, we have to inhibit the histamine receptor. So antihistamine such as diphenylhydramine inhibits the histamine receptor on the cell surface, so blocking the release of histamines. So for that we can take adrenergic drugs and other drugs which block the release of histamines from the mast cell. And along with this, steroids and chromoglycate also inhibits the release of histamine.